Finding a better way. Isn't that what being a medical professional is all about? What if there were a better way for you to ease suffering, eliminate pain, and improve the lives of your patients? Now there is a better way for the hundreds of thousands of people who suffer from ocular surface disease, or dry eye syndrome, as it is more commonly known. For years, patients who have suffered from the symptoms of dry eye syndrome have been treated with a wide range of medications and artificial tears, resulting only in short-term, minimal relief. Now, you, as their eye care professional, can offer them a better way. Long-term punctual occlusion, utilizing one of the most innovative and advanced designs available today, the Ready-Set Punctum Plug from FCI Ophthalmics. FCI's Ready-Set Punctum plugs are uniquely designed to be the most efficient and comfortable plugs available. Made from a state-of-the-art non-dissolvable silicone, the Ready-Set plugs are specially cut to follow the natural contour of the eyelid surface at the point of insertion. Only the tiny slanted collarette remains visible, resting flush along the eyelid margin. This assures a tighter seal, maximum comfort, and permanent relief. Inserting the plugs is a simple non-surgical procedure. It's virtually painless to the patient, and it can be performed in a few minutes right in your office. As you know, dry eye syndrome is a very common problem in both men and women of any age. Some of the more common causes for dry eye include the aging process, menopause and pregnancy, contact lenses, medications, and a variety of environmental conditions. If your patient meets the previous criteria and exhibits symptoms such as burning or stinging, a gritty feeling when nothing is in the eye, dryness, itching, sensitivity to bright lights, or mucus secretions in the eye, they may be suffering from dry eye syndrome. Start by conducting a thorough examination. This can include an evaluation of tear production using the Schirmer test. If dry eye syndrome is confirmed, the next step is long-term closure of the tear ducts using the FCI Ready-Set Punctum plug. Begin the procedure by first anesthetizing the eye with a topical anesthesia such as proparacaine. To ensure an efficient and comfortable fit, you'll need to select the FCI Ready-Set Punctum plug that is the right size for your patient. Ready-Set plugs are available in 5 sizes: micro, mini, small, medium, and large, ranging from 0.4 millimeters to 1 millimeter. To determine the correct size needed for each punctum, use the FCI gauge system. This unique set of combination gauge and dilator instruments, which is available only from FCI Ophthalmics, comes in a plastic sterilizing case containing 4 titanium instruments. Each instrument has a punctal gauge on one end and a dilator calibrated to that specific gauge on the other end, giving you the ability to size and dilate using the same instrument. Begin sizing with the smallest gauge. If the gauge slips in freely, move on to the next size. The correct size is achieved when the gauge meets with some resistance. Once you have determined the correct size, begin to dilate the punctum in a progressive manner while rotating the dilator between your fingers. Keep in mind, the extra small plug size requires little or no dilation. When the desired dilation is achieved, swiftly insert the plug in place. Note that the punctum constricts within 15 to 30 seconds. Therefore, do not hesitate to insert the plug. It may be necessary to repeat dilation to facilitate plug insertion. To insert the plug, hold the inserter between the thumb and index fingers, and then orient the plug so that the raised portion of the collarette is nasal. A likeness of the plug is stamped on the instrument to indicate the direction of the collarette slant. Introduce the plug vertically in a gentle and progressive manner. The inserter will retreat slightly at the moment the bulb portion of the plug goes through the punctal opening. Once the plug is properly positioned, with only the collarette resting on the eyelid, release it from the inserter by pressing together the instrument handles. This will retract the insertion tip, leaving the plug in position at the punctum. Verify that the plug is in the proper position. If necessary, rotate the plug so its collarette lies flush against the eyelid margin. Again, the raised portion of the collarette should be nasal. If necessary, removal of FCI plugs is easily achieved. Simply grasp the plug underneath its collarette with blunt forceps and gently pull the plug along its axis out from the punctal opening. There is a better way. FCI ready-set punctum plugs, uniquely designed to be the most efficient and comfortable plugs available, featuring the characteristic slanted, anatomy-friendly collarette which prevents migration of the plug inside the canaliculus and provides visibility for monitoring and easy removal. The bottom of the plug, or bulb, is designed to keep the plug from backing out of the punctum, and the neck of the plug fits snugly inside the punctum, maintaining proper positioning. FCI plugs are ready-set or preloaded onto the disposable inserter, and they are packaged individually sterile, 2 preloaded sets per box. FCI ready-set punctum plugs, available to you in 5 sizes from 0.4 millimeters to 1 millimeter, giving you the right choice for your patient's comfort. FCI also offers an exclusive perforated or flow-through plug for punctal stenosis. These plugs have a 0.6 millimeter opening through the entire plug, which allows unobstructed tear flow through a stenosed punctum. Finding a better way. That's what it takes to be a leader in the field of ophthalmology. And at FCI Ophthalmics, we've found a better way. The ready-set punctum plug with a slanted collarette. The natural solution for clear, comfortable vision.